I'm Dr. Serena, and I am a veterinarian and veterinary behavior resident, and I'm joined by my producer, Randy.
Hi.
Randy is a dog dad, so he has some experience with dogs, so he can weigh in on this. I have a video I wanted to share. The reason I wanted to share it was I commented on the video, and then the original poster commented back, and then someone else commented on that, and then they wanted my opinion on their comments. So, all of that to tell you, we're going to watch the video.
Let's proceed.
Here we are.
Style of training is very prevalent in a lot of training companies. Some of the different techniques that I've heard from different trainers and clients of what to do when your dog is barking is one of them, slam your hand on top of the crate until the dog stops barking. Have a little bag full of like metal washers, throw it at the crate until the dog stops barking. Spray the dog with water until it stops barking. And of course, the bark collar / e-collar method. Anytime the dog barks, they get a correction. And with the e-collar / bark collar method, there's basically two ways dogs respond to it. Dogs that immediately are just quiet because they are not happy with the stim that they felt, which is the entire point. Or dogs that you have to continuously correct over and over again, and they get louder and louder until eventually they give up and they're quiet. So basically, you have to be comfortable with watching your dog go through a certain level of fighting it until they eventually give up. And that one's a very unpleasant one to see. Watching a dog fighting through a correction over and over again until they eventually just give up, it's not good. But it's a very common training method that a lot of trainers do to crate train dogs. I do want to say, though, I cannot speak in 100% absolutes for this training. The only situation that I could justify this is if somebody is at the point, usually in condos, being either evicted and homeless or giving up your dog. Personally, I feel like temporary suppression is better than becoming homeless or losing your dog. Those are also horrible choices. But if that is your go-to method as a trainer.
My comment. Oh, here it is. So I said, using medications is better than instilling fear and learned helplessness. While I do agree, many dogs I've worked with have come in on meds and are still losing it in their crate. Sky, the dog trainer. Still to this day, I've never found a client that was using medication and wasn't trying to use the least amount instead of focusing on using the right amount to change the behavior. So that's talking about medications. Most of the time when that happens is because the owners are trying to use the least amount of medication possible, but it's not how we should be using medication. We should be using medication until we achieve the desired change of behavior. The benefit of doing this versus implementing an aversive is that you won't be back tracking the counter conditioning like how an aversive would. You want to say something?
I have a question. First of all, my comments and questions are my own. As a layman, I just wanted to say that my first observation was losing with double O's leads me to my first question. How legitimate is the education of a trainer? Are they trained? Is it passed down like a carny, or are they actually trained in a legitimate schools?
So Kat the dog trainer is not a certified professional dog trainer. She works in Toronto. She is what's called a balanced trainer. Balance means that they use all four quadrants of operant conditioning. She heavily leans into using more positive than aversive methods. However, she does put a prong collar on a lot of her clients' dogs. She is not certified. I believe, now this is just from watching her videos, I believe her boyfriend, Tyler, the dog trainer, I believe she's learned a lot from him. But she's also quite good at reading body language in dogs.
But in the community of the animal metaverse, the animal internet, this person is seen as legitimate.
She's seen as legitimate because of this many followers, 309,000. So I would say that most of the certified professionals write their certifications on their profiles because they've put in the time and the, funds and energy into getting certified. Most of them will put the fact that they're certified in their description. So I don't think Sky the dog trainer is certified. But again, 515 followers. So that becomes kind of a problem in the sense that individuals who are laymen, or they just are dog owners, or maybe they're interested in dogs, they're more likely to follow accounts that have a greater following,
Okay.
as opposed to, let's see.
You're talking about credentials? Oh, her account.
Think of you. Now you're gonna see all the things that I follow. Here's a chicken eating egg.
Ooh, that's cannibalism. That's what it is it not? Isn't that the point?
Hello.
Okay,
Hello.
so here we go. Oh, Joss is a certified dog trainer, but she has 3,000 followers.
Where is it stated that she's certified?
Specializes in separation anxiety.
No, I'm just curious.
She's a graduate from the renowned Academy of Dog Trainers, as well as the Animal Behavior Program at I believe UW is University of Washington, and she's a certified separation anxiety trainer. So that's one of them.
Okay, I was just curious.
So Tilly the dog trainer, Tilda Moore, and there's her professional certifications here.
Mm-hmm.
So CPDT, KA. So that's the Certified Professional Dog Trainer Knowledge Assessed. So she's gone through the examination to have her knowledge assessed as a dog trainer. I'm not following her, but I'm going to hit that follow button.
Gonna go ahead and hit that follow. Hit that like, hit that follow. Smash that like, hit that follow.
So most of the ones who hold a certification will have that written in their like description somewhere. Bio.
Does taking your dog?
What's up, man?
Okay.
So there's two aspects that I wanted to kind of talk about. Is that there's the using a crate for crating your dog while you're at work. So that's going to be the typical 9 to 5 person, Monday to Friday. They're crating their dog and then they're leaving their dog at home all day by themselves.
Mm-hmm.
And so early on, when you first get your dog, you want to start working on the training. But in Kat's case, because she's living in Toronto, she's dealing with a lot of dogs who are living in high-rise buildings, condominiums, where these dogs are being left in an apartment. And if their dog doesn't want to be left at home alone, then these dogs are barking. Mm-hmm. And they potentially get noise complaints and potentially get notices about these noise complaints.
Mm-hmm.
And if they're at risk of eviction, so in a condominium, I think the noises aren't as bad. But let's say you live in a basement suite. I mean, you've lived in a basement suite before.
Mm-hmm.
You can hear a lot of what's going on above, below. So if you're living in a basement suite and you're renting and you have a dog and that dog is barking while you're at work, then you're more likely to get noise complaints and be evicted or notice of eviction. And so people are always looking for a quick fix to the problem with the barking. If that dog has a separation related disorder, now we are calling it separation related disorders because that can encompass anxiety, it can encompass fear-based problems, as well as frustration or barrier frustration. So the dog becomes frustrated that they are locked away in a crate. And it has nothing to do with the owner leaving. It has everything to do with them being frustrated that they're locked in the crate. And all of those fall under that separation related disorder or problem. How you treat it will depend on what emotional state that pet is in. Some of them will have a panic attack. And if a pet owner cannot recognize that it's panic due to extreme fear, and you try to train by using aversive methods by shocking the dog every time it barks, the problem that happens is that you can develop something called learned helplessness. Learned helplessness is the condition in which the learner has learned that whatever behavior they do, it doesn't matter, and therefore they give up and they present with no behavior. A lot of the dogs in those scenarios have been extremely traumatized, and if you look at them, they lack affect, they lack the ability to show emotion. It's like they are depressed.
I would think that that was the state that you'd want your dog to be in if you weren't home. But I suppose you want them to behave that way, but still while being happy, right?
You want them to be quiet when you're not home, right?
But you want them to play quietly as opposed to laying there like a bump on a log. Yeah.
Hey, and so some pet owners end up being put in a scenario where they're struggling. So while Kat, the dog trainer, doesn't recommend to use the bark collar, shock collar when you're leaving your dog at home, she also doesn't recommend using medications either. And the reason for that is because there has been failure of follow-up with the use of pharmaceuticals to help dogs with separation-related disorders.
Okay. So what is she suggesting? What is her happy medium? Best.
She would rather use aversive method, shocking the dog, over, hey, maybe you should go and talk to somebody about medications.
What about what we use with the audio camera? But she doesn't. It doesn't worsen. She tends to calm down and then act like a human.
Let's say, for instance, I'm talking to her through the camera when she's on the back porch barking at the neighbors.
And then she goes,
Yeah, and she stares at the camera. But she's confused. She doesn't know where I am.
Yeah.
But when the only reason that she's barking at the neighbors is because I'm not there to support her and guide her in making the right decisions.
And by the way, confusion is not a state of mind that she is unused to. I think she's confused pretty much all the time that she's awake about one thing or another. So, anyways, I digress.
It's not always confusion.
I'm just kidding.
She experiences a lot of frustration. Frustration being the emotional response of unmet expectation. But for the most part, her frustration doesn't escalate.
Yes.
Whereas many dogs, their frustration can escalate to aggression or self-trauma if they're locked in a
Like
crate.
chewing.
Yeah, if they're locked in a crate and they're digging. I have one patient that has been chewing on their tail. So the pet parents leave her in the crate. When she gets too aroused, then she starts self-mutilating.
Yeah, I've known of a dog who used to chew her back leg,
Yeah.
his back leg. Pepper, girl guy, who knows?
So the goal with medications, just like Sky the dog trainer, is that you should be using medication until you achieve a desired change in behavior. There's two aspects to a separation related disorder. One is if they truly do have anxiety. Let's say they've been diagnosed with anxiety, keeping in mind that veterinarians are the only ones who are legally allowed to diagnose conditions in animals. Because people will be like, I'm doing a diagnostic approach. And then they will say, oh, yeah, your dog has separation anxiety. But legally, only veterinarians can diagnose that. But let's say that we do have the diagnosis of separation anxiety or separation related disorder. We're going to be having medications for generalized anxiety, so anxiety on all the time, because 5 out of 7 days of the week that human is leaving the house. There are also comorbidities in that dogs who are noise sensitive or noise averse or have a fear of sudden noises also have separation related disorders. And so when you have comorbidities, you're more likely to have that dog on an anti-anxiety medication like an SSRI. And you're going to use your as needed medications, usually a sedative, because dogs should be sleeping 14 to 16 hours in a 24-hour period. And they can be sleeping for the most part when you're at work. There's no reason that they need to be awake. And so then you can use a sedative for when you do have to go. And then there's going to be the training aspect. Usually when you're training, you don't want your dog sedate because they're not going to learn when they're sedated. So you're going to have your SSRI that you have to start, and you need at least 4 to 6 weeks in order to know whether or not that SSRI is working. And then you add on your PRN, which could be a benzodiazepine like Xanax or Ativan. Or you're adding on trazodone, which is something that's labeled for insomnia in people. Or you're adding clonidine, which helps calm the adrenaline system. Or maybe you're adding gabapentin, which is like the brake in the brain. But you don't just give the medication and leave the house. You have to try the medication to see if that medication is appropriate for that dog. Because you can actually get paradoxical excitation. So you want a dog that's sleepy while you're gone, and you can get the complete opposite, where they're frantic and excited instead.
Oh boy. Vodka and Red Bull style.
Yeah.
Evita.
So that's generally the problem, is that it hasn't been communicated to the pet parent that they need to try these medications first before you just give them medications and then leave the house.
Okay. So is this perhaps the type of information, like a lot of pet care information, that is given when you first bring your puppy in for a checkup, where you'd say, if your dog, perhaps you might add to your spiel, If your dog experiences these types of issues while away from you, or you're getting complaints about your dog's noise levels while you're gone, perhaps you want to bring them back in for a psych evaluation.
So,
Most people wouldn't think that their dog would need a psych evaluation,
yeah.
especially if you haven't been a pet owner before.
No, no. So let's say, for example, you bring your puppy to the vet, and usually, if you're getting a puppy, let's say, like we'll take rescue dogs out of the mix. If you're getting a puppy, you'll usually get them around 8 weeks. Your first vet visit usually ends up being around 12 weeks because typically the breeder's done their first set of vaccines. And then at that 12-week visit becomes all the questions, the concerns, everything, and then boosting their puppy vaccines. The problem with general practitioners is that they will tell puppy parents, hey, it's not safe to take your puppy anywhere until they've had their full set of vaccines. And so the socialization window closes somewhere between 14 and 16 weeks, but their final puppy vaccine is at 16 weeks. If you haven't taken your dog to experience things during that early socialization window, then you've already missed those opportunities. So early on, in order to prevent separation related problems, is actually to leave your dog alone early on. But
Mm-hmm.
in place of your attention, you give them something to do. So, like the dissection boxes
Mm-hmm.
or the topple with the frozen food in it.
Mm-hmm.
But they have to be willing and engaged with that before you could safely leave. If they're already amped up and they're not engaging with that, then you've already gone over that threshold.
Mm-hmm.
If they're not engaging with the food item or the dissection box, if they're engaging with it, then you're safe to
Mm-hmm.
move along.
So these are ways to mitigate these kinds of potential psychological issues in terms of separation or frustration in a maturing dog.
Yeah, exactly.
But what about what was I going to ask? I had a specific question about so if your dog is more mature and they develop these issues.
So let's say your
So,
dog.
so, so if your dog is more mature and they develop these issues, what you're saying is to that a good response to these anxieties um, is what do you call it? What did you call it? A sleeping pill?
Oh, using sedation. But
S-
yes,
sedation, but try it on the weekend or during a prolonged stretch of being at home so that you can see the effects of it.
yes, exactly. So the gold standard with separation related disorders is to not leave your dog alone. And if you're going to leave the dog alone, they should have some anti-anxiety medications on board. The
Really?
clonidine, it's not quite like a beta blocker, but you know how you feel that rise in adrenaline and you take a beta blocker and you don't have that? That's where the
Oh,
clonidine is helpful.
why, yes, I do.
So we call it PRN or as needed medications. But you can use those medications every single day. If you think about the side effects of not treating chronic levels of stress and anxiety, what that does to the blood pressure and the heart and that sort of thing, compared
Okay.
to treating it.
So Do you think that you've sufficiently answered the question of Sky the dog trainer?
I'm basically reiterating that yes, you want to use medications appropriately. And when you're using the medication, if that veterinarian is not following up, I mean, we should, as pet parents, be advocating for our own pets and say to the vet, like, hey, what you prescribed me isn't working. If that is out of the scope of practice of that veterinarian should be referring. For example, if a dog has an ACL tear, I'm going to refer that dog to a surgeon. I'm not doing that repair myself.
Mm-hmm.
So if a dog has a severe behavior disorder, you should be referring that dog to a veterinary psychiatrist, which would be a veterinary behaviorist.
Mm-hmm.
And so there's plenty of primary care veterinarians who will either say, no, your dog doesn't have anxiety and I'm not prescribing the medication,
Mm-hmm.
or prescribe the medication and have no follow up and no understanding of behavior modification, that you don't do just medication. You do medication and therapy in the form of behavior modification.
I feel that I feel that at some level this is a hearts and minds issue. It's almost like politics. There are many people out there whose beliefs do not include that that psychological issues exist. So if they themselves won't see a therapist for issues that require a therapist, they probably won't do so for a dog. Then there are a lot of people who um, maybe struggle financially or aren't able to justify spending the that kind of money on a specialist, a psychological therapist for their animal.
Yeah.
And it's a matter of how then I guess on the priority list, how important uh, are this animal's issues when it comes down to what the money is is allocated to.
Yeah. Yeah. If it means that they can't put food on the table versus treating their dog. I mean, there are a ton of other people who, like, if you look at the brands of dog foods that they're purchasing for their dogs, I mean, there are places to cut corners and still provide the care. Because, like, there's something there in animal welfare, there's something called the five freedoms.
Mm-hmm.
And one of the freedoms is fear from fear and distress. It started out in food producing animals, that the animals that we produce to be consumed for food should not be experiencing fear and distress.
Yes, I'm familiar with this. Yeah, just clicked in. Yeah, we watched a documentary a little while ago that mentioned something about this.
And part of that is also the freedom to express normal species typical behavior. And if we're not able to provide our dogs with the ability to perform species typical behaviors, if we expect them to walk on a leash, which is a human construct, not a dog construct, and not provide them with an outlet to perform normal behaviors,
Mm-hmm.
then you end up with a dog who has problems.
That is pretty much, I would say, over 50% of people in major metropolitan areas.
Yep. And while it comes down to, nature and nurture, dogs will be genetically predisposed to be either more resilient in metropolitan areas or less resilient in those areas based on how we as humans have selectively bred the dogs. For example, herding breeds. Herding breeds should be herding sheep. But then you take a border collie and you try to get that border collie to live in an apartment and to live in an apartment with a family of toddlers who are running around screaming. And then you expect your border collie to understand and not herd the children and not nip at their ankles when they're being rowdy.
Mm-hmm.
So it's unrealistic expectations for the breed that family has decided to bring into their home.
So either herding sheep or herding you. Okay.
And then there's crate training. Crate training is complete side. So you don't need to crate train your dog, and you don't need to crate train your dog who has separation related disorder. You can create a safe place in your bedroom closet that could be their place that they gravitate to when they want a safe place.
Okay. Well, do you want to quickly run through and point form all of the things that you mentioned that you can remember?
Yeah. The thing is that it comes down to client communication. Like Kat says here, patience and proper crate training are what helped. Bark collars are still not helping, but they're bought by people sometime because they feel like that's the only option that they have. But arguably, if you shock a dog who has anxiety and fear, you will be taking steps backwards if your ultimate goal is to help them through their fear and anxiety.
Meaning?
It's kind of like children who are upset and crying, and the parent says to them, "Stop your crying, or I'll give you something to cry about."
Yeah, I've been there.
How many people from our generation have? 90%.
Yeah. I mean, I think 90% of people from every generation have been there.
No, because the newer generation is different. They're more empathetic and compassionate, the younger generation.
I would say publicly, but I mean frustration is frustration. I think that a lot of times with pet parents and with social media parents, you're always going to see, for the most part, what you see as their best behavior. But I mean, frustration is frustration. And I think that parents in general have the need to live their own lives and have their own, have some distance from the frustration of parenting, because let's be honest, it is a little frustrating at times, or quite frustrating in certain moments.
Yeah.
So I think that modern parents get just as frustrated, and although we see their best moments, oftentimes their worst moments aren't on camera.
Yeah. Their worst moments aren't on camera. But at the same time, the younger generation also is more likely to treat their own mental health versus our parents' generation, where mental health problems were, like you said, they don't really exist. The predominant number of aversive trainers or aversive dog trainers are men.
Hmm.
The majority of certified professional dog trainers, so ones who are educated, are women.
Mm-hmm.
The majority of the positive reinforcement dog trainers are women. And the
Mm-hmm.
majority of coercive, forceful, balance trainers are men. And so there is already a dichotomy. And there is a challenge when you have a gentleman from an older generation to take some of the knowledge when it comes to mental health
Mm-hmm.
that if they survive through it, of course, everybody else should survive through traumatic events.
Mm-hmm. Yeah, I would say that's truism. Yeah, I think that a lot of times, I would not like to generalize, but I mean, naturally speaking, women, I think, possess more empathic, nurturing qualities. Um, have um, the more you'll be likely to use it. One thing that I think of often is that a lot of these issues, these mental health issues, proliferate in our generation, in newer, younger generations, which, uh, because of the way the world has changed, the vast amount of information that we do have provides more stress, creates more stress at times. There's just
Yeah.
more to manage. And you're required to do more because you're capable of more with technological assistance. And prior generations, yes, they had many mental health issues and and but and other traumatic factors that they had to live through. But part of my issue is that why I cut them a little. Well, I don't view them as harshly as sometimes I do from this perspective. Being in 2024, is that um, a lot of times they naturally dealt with those things that we don't. We tend to be more less communal in this generation or this particular time and place. I think that my dad, for instance, would never see a therapist, but he'd call his friends over for a barbecue in a heartbeat. Whereas I would maybe text a couple people and see if they responded. And if not, then I'd maybe call BetterHelp because that's the outlet, right? But I think that
We are not sponsored by BetterHelp.
yeah, but I'm just saying that generationally speaking, I think that um, sometimes we don't give credit to the ways that these things were handled. The people had more home remedies and maybe more trial and error, but they were trying to take care of things. And I'm not sure how effective they were, but they had different methods, you know?
Yeah. I guess the problem also becomes is that when you are using things like YouTube and TikTok to gain your knowledge, to build your expertise,
Mm-hmm.
the content that you're consuming will affect your knowledge base. And instead of going in with an eye of saying, like, hey, does that actually make sense?
Mm-hmm.
Or from the perspective of even saying, like, hey, dogs are sentient beings, they can think and feel.
Mm-hmm.
Because there's still some that wouldn't say that
Mm-hmm.
dogs are able to feel emotions like we do.
Yes. So you're saying that the shared consciousness right now in society and hearing people speak more about their dogs and their personalities affects you somewhat, affects you, what's the term? You're saying that people absorb it but by just the natural change of discourse about animals and pets, pet ownership.
I'm saying that when people are consuming content on these platforms, and both from the perspective of their algorithm. So if you click on certain content, you're going to be fed other content that's similar.
Mm-hmm.
It's kind of like, Democrat versus Republican. You might go down that wrong rabbit hole. And certainly when I first entered this platform, if I watched one video and I was like, oh, cool, yeah, okay, I'll follow that person, then I ended up getting fed a lot more. Just like politics, you have really, really right wing people and really, really left wing people, but most of the people fall in the center, right? And then you get the people in the center arguing,
Mm-hmm.
whereas it's the people on the ends,
Mm-hmm.
the really like harsh dog trainers
Extreme.
who are like actually abusive, choking dogs, hanging them by their throats. Those are the ones that really we should be trying to get rid of.
Mm-hmm.
Instead of the people who are like, I use only treats. I don't say no to my dog at all.
Mm-hmm.
And the people who are, I use treats and I use a prong collar. Those are the ones who are sitting there arguing.
Mm-hmm. You
Nicole.
find that the bickering happens between the people who are least harmful, and the people who are harmful are left alone to their own devices.
Yeah. Like
Huh.
why can't everybody over here in the middle being like, those are the ones that are actually causing the harm and the trauma? Those people. And those are the people with the highest number of followings, like the dog daddy.
Mm-hmm. Mm-hmm.
And the dog
Yeah.
daddy sits there and says, they had no other alternatives. They tried everything, which I'm sure isn't the case.
I would I would venture a guess that those people have a lot of views and a lot of followers, but most people don't actually carry out those techniques. I mean, I would assume so. Otherwise, there would be a lot more people in prison for these things. No.
Because dogs are still considered property unless the person who owns the dog complains about that person, then those people are not getting charged.
Mm. So you're saying that just the way many extremists are banned from these platforms, these dog training extremists should be banned from platforms.
It's
If
it's a challenge because you know how like you can report animal
an account,
abuse or misinformation and that kind of stuff.
mm-hmm.
So if you go and report like animal abuse or the perpetuation of animal abuse, and whoever does the like community guidelines just ignores it, or it says like it's not big of a deal, we don't care about your report, it's frustrating.
Mm-hmm.
It's like, no, I physically see an animal getting abused on these platforms in a video because people are making these videos so that they can get clicks and buy-in and all that. But it's still being produced, it's still being put forth. So we're perpetuating animal abuse by not taking those things off of these platforms.
Mm-hmm. Understood. The word I was looking for was osmosis earlier.
But instead of opening up a textbook or opening up a scientific journal to understand where the holes are in some of the dog training content,
Mm-hmm.
just that specifically, is that they're going to be like, oh well, so and so has 1 million followers, so they must be right,
I suppose so.
instead of following the people who are actually certified professionals who know what they're doing and have the education behind it. But it has to do with entertainment. If it's not entertaining enough, then why would they want to follow it?
Yeah, I think it's more that human beings are inherently followers. So if they see a big crowd somewhere, they tend to wander towards the crowd. And it makes it easier. I think that vetting who is knowledgeable and who is a fraudster requires work. And as we move towards a more automated society, people are looking for indicators that help them avoid work.
Yeah.
And followers is one of those indicators. Many people don't necessarily believe that the thing works, but if they're in need of something to to help solve an issue, they tend to go where the crowd is. For instance, supplements. If Joe Rogan suggests something, most of their friends probably are doing that same thing,
Yeah.
and they will be likely to follow that particular trend as opposed to going and finding someone who is knowledgeable and learned
Yeah.
and having to go through that protocol that is less tested
Yeah.
or less believed.
Yeah. It's like dog trainers who had a dog, they trained their own dog, and then they trained, their neighbor's dog, and then they called themselves a dog trainer.
Mm-hmm. Yeah.
It's
As a certified personal trainer, I feel that pain.
Yeah, it's the same thing happens with personal trainers. It's that you trained yourself, and then you trained your mom or your dad, and then now I'm a personal trainer.
Mm-hmm.
If you can look the look.
Yeah, if you can carry it off.
My problem becomes when the dog trainers, instead of working as a team with the pet parent and the veterinarian, is that they bash the veterinarian and then tell the pet parents to, stop using those medications or those board and trains. Board and trains are the ones where you give your dog to someone else and then you let them abuse your dog without you even being there, to train them.
Mm-hmm.
And then it's those ones who are like, well, I'm just gonna like take this dog off their medication. It's no big deal, right?
Mm-hmm.
We live in an area where there's a lot of aversive dog training.
Okay. Country.
Exactly.
So basically what you're saying is to avoid the issue of animal anxiety, pet anxiety from isolation, you would suggest something like a doggy daycare. And then after that, you would suggest some kind of sedative.
Yeah, so if you have to leave your house, you either get a dog sitter, someone to watch your dog. You can take your dog to a doggy daycare if they do well with other dogs. You can take your dog to work if you have the ability to do that. Or using medication to help your dog with anxiety when you have to leave the house.
Fair enough. I'm buzzing you to end this podcast, this response.